Namaskar. My heartfelt thanks to Delhi ISAR for giving me opportunity to be standing before you and delivering this lecture. It's not going to be a professorial lecture. I am a simple gynecologist, but I'll try to open your eyes to the miracle, what's called Aaj Ka Bharat. 48 years back, the country moved to IVF journey from struggle to world-class success today. It's not the story of science, but of courage, conviction, commitment. We belong to a nation where impossible slowly turns into success, and we say, we did it. Now with these words, I'm going to unfold the success story of IVF-ICSI journey of Bharat, its achievements, innovation, and excellence. Today is the day of tribute to Dr. Subhash Mukhopadhyay, the father of the first test tube baby in India. Unfortunately, Dr. K.C. Anand was thought by the government as the father of the first test tube baby in India. But he gracefully gave this particular title to Dr. Subhash Mukhopadhyay once he came to know about the facts. Infertility is increasing, and it is nearly 10 to 15% of married couples who have the problem of infertility. Only 1% only actively seek infertility treatment. Infertility is on the rise because of increasing maternal marital age, rise in a working woman, and getting the vices like alcohol and tobacco consumption. And we all know that sedentary habits and overweight is also bothering our girls. Polycystic ovarian disease, there is a boom. Endometrial tuberculosis is our country's USP. And we all know that poor ovarian reserve has become a big problem in South Asian countries, especially in our country. And we are facing this particular problem left and right. I repeat again, 1% of the infertile couple seek medical treatment, showing a significant gap in healthcare awareness and accessibility. As far as the IVF milestones are concerned, it started with experiments in rabbit. The success was there, and then it came on human beings. First, the abortion was noted after following pregnancy in Australia, then the birth of the Lucy Brown, and then the first IVF baby from India. Subsequently, the donor IVF, the surrogacy, the vitrification, PGD, and the ICSI evolved and made a landmark entry. Early pioneering days of IVF ignored India. India's IVF journey began just 67 days after the first IVF baby, Lucy Brown, which we celebrate year after year on 25th July 1978. Dr. Subhash Mukhopadhyay created India's first test tube baby, Durga, in 1978, and he remained unsung hero, unsung pioneer during his lifetime. He worked alone without the government or the peer support. He committed suicide in 1981 due to neglect by the colleagues, due to humiliation by bureaucrats, and our first IVF martyr is Subhash Mukhopadhyay. The scientific national recognition came to him posthumously when India officially recognized Durga as our first IVF baby. His sacrifice laid the foundation of India's ART journey. Later, Dr. T.C. Anand confirmed his work and pushed for official recognition. This picture speaks volume about India's first IVF baby when she celebrated her 40th birthday. Now, subsequent to the first IVF baby of India, India's second IVF baby, Harsha, was born in 1986 with the joint effort of Dr. T.C. Anand and Dr. Indra Hiduja in KM Hospital. So let's rewrite the history of IVF in Bharat. In October 1978, India's first test tube baby, the gentleman ended his life in 81. Then in August 1986, Harsha was born under Dr. T.C. Anand and Dr. Indra Hiduja. Till then, it was known that the father of India's first test tube baby is Dr. T.C. Anand. 16 years later, Suneet, cryobiologist working with Dr. Subhash Mukhopadhyay, showed Dr. T.C. Anand's all notes, and then he very gracefully accepted that this title of Father of India, a first test tube baby, goes to Subhash Mukhopadhyay. Now, since then, India has become the world's second largest IVF market. We have more than 3,000 ART clinics. India performs more than 3 lakhs IVF cycles annually. And ART success rate is around 40 to 50% in live births, which is comparable to top centers in the world. India's projected fertility sector will cross 50,000 crores by 2030. We have everything today. Time-lapse embryo monitoring, vitrification, blastocyst culture, all are routine in our IVF centers. Coming to the regulation and ethics, India is among the first Asian nations to have a national guidelines. Since 2005, our ART and surrogacy bill came in 21, and this now regulates IVF practices, donor gametes, surrogacy, protecting patients and children. Coming to our further achievements and excellence, I again repeat, our success rate is comparable to the best in the world, which Esri and Ashton have made the benchmarks. ICSI was introduced in 1992, but India was quick to have almost 95% cycles of male factor infertility where ICSI is done. Coming to the cost and innovation, our cost is 1/5 to the cost of US and UK without compromising our outcomes. Indigenous innovation have cut down the cost by almost 40%, and it has proper ICMR validation. Medical tourism has increased to 10% annual growth in fertility tourism due to quality and because of decreased cost. Coming to the safety, OHS's rate has decreased less than 1.5% in accredited centers compared to 3 to 5% globally. This is due to GnRH agonist trigger adoption. Single embryo transfer is our goal. Few clinics have just started it, reducing the multiple birth rate, which is a big problem and complications, and rest of us have to walk the talk to start single embryo transfer. The lab standards, the accreditation of NABH has risen to 68% in IVF centers, again giving credibility to our IVF centers. As far as global recognition is concerned, IVF in India has ended the stigma for millions of Indian couples struggling with infertility. Single women, elderly women less than 50 years, cancer survivors, genetic disease carriers now have a hope. Our experts are chairing the biggest bodies and shaping the ART guidelines. We are one of the big capacity builders to train ART experts, not only in our country, but in Asia and Africa. Now, as far as the evidence-based imperatives as accepted by Indian ART experts, routine PGS for all ages is not recommended. It is reserved for a recurrent pregnancy loss and advanced maternal age. Endometrial receptivity era never won the hearts of the Indian IVF experts. The problem of thin endometrium is almost solved in simple, structured way and is now within the reach of all IVF experts. As for the luteal phase support is concerned, micronized vaginal progesterone remains the gold standard. But it pains me when I find everybody using loadful of progesterone as a luteal phase support and in pregnancy. It's a big problem. Time has come that we give up this obsession. Coming to the guideline adoption, NTAC protocol has dominated now. 95% cycles are NTAC cycles, reducing OHSS significantly. Freeze-all strategy is also accepted by a majority of the people, and it is recommended, especially in PCOS and high responders, cutting incidence of OHSS risk by 5-fold. PICSI and other sperm selection techniques lack robust evidence for routine use, and that's why not popular. Coming to equity and ethics, insurance coverage is only 12% in Indian states, which include IVF. It's a critical advocacy gap, and I feel that all IVF should be covered under the insurance. Despite ART Regulation Act, surrogacy and egg donation guidelines need stricter enforcement by the government. Rural access is the need of the hour, and there had been a study by AIMS to see this particular area, and this consultations were used, and this expanded their reach by 300%. And I think the government in India platforms to be created for rural access. Coming to the future forward, AI integration, Pan Bharat, all AIT experts need AI help. There had been again a study between AIMS and the IIT and showed a 20% higher viability prediction, and I'm sure this will be reality in near future. There's a big market of antioxidants, which is industry driven. We do undertake brainstorming sessions to find out what should be grasped. The truth abhi bhi dur hai. And still our gynecologists who are ART experts are trapped in this industry-driven market. There is no correlation found between cycle cost and the low birth weight in Indian multi-center study. बड़ी दुकान का मतलब ये नहीं है कि सब कुछ अच्छा है वहाँ. Coming to the call to action, we all need standardized protocols. This request was made time and again for ovarian stimulation, lab works, and ET techniques. But we Indians are notorious that we do not believe in uniting, learning from each other, sharing, and serving. Thanks to ASHRI 2025 conference, it opened a simplified Pandora box for all ART experts, what to use and what not to use for ovarian stimulation, lab workflows, and ET techniques. Mental health integration has done wonders. The mandatory counseling have reduced the dropout rate of IVF by 22%, but I think this mental counseling is needed for ART experts as well. Public IVF centers, again, people should learn from South, the Kerala and Tamil Nadu subsidize IVF to public, the first just 50,000 rupees, and I think this need to be scaled nationally and promise that no dream of parenthood shall remain unfulfilled. It is mandated that PGD-M and PGD-SR for monogenic disorders to be used more frequently by the ART experts. Male factor dominates in 50% of infertility cases, and that's why we advocate andrology labs in all ART units. DNA fragmentation tests from my side should be part of every workup of a male. So finally, coming to my closing remarks, Bharat IVF revolution proves excellence. It also speaks loudly that things need not be expensive. Our cost is 1/5, but our success rate is comparable to the global benchmark. Let's celebrate growth and honor of Bharat. We celebrate our identity. Yet, we collectively demand governance, innovation, but never ignore guidelines. For every life we create, we owe the rigor of science and training. We salute our pioneers who gave their lives for science, gave a future of affordable, accessible, ethical ART. And this is today's Bharat's journey. IVF story, resilient, responsible, ready for global leadership that every ART expert should be proud of. I think with these words, I leave you with Bharat's achievements, and we celebrate our identity with that. Thank you very much.